spironolactone dehydrochlorothiazide, ANS. Mannitol increases osmotic pressure and promotes excretion. Q866. Which drug is commonly used in glaucoma? A. Timolol, B. Atenolol, C. Propanolol D-digoxin, ANS. Timolol decreases aqueous humor production and lowers intraocular pressure. Q867. Which drug is used as an antiplatelet agent after myocardial infarction? A. Clopidogrel, B. Heparin, C. Warfarin, morphine, ANS. Clopidogrel inhibits ADP-induced platelet aggregation. Q868. Which drug is a selective serotonin reuptake inhibitor? A. Sertraline, B. Haloperidol, C. Diazepam D. Lithium, ANS. Sertraline increases serotonin levels in the CNS and is used in depression. Q869. Which drug is used for fungal skin infection? A. Clotrimazole, B. Acyclovir, C. Penicillin D. ANS. Clotrimazole damages fungal cell membrane by inhibiting ergosterol synthesis. Q870. Which drug is used as an antiarrhythmic agent? A. Amiodarone, B. Aspirin, C. Metformin D. Omeprazole, ANS. Amiodarone prolongs cardiac action potential and stabilizes abnormal rhythms. Q871. Which drug is used in peptic ulcer disease as an H2 blocker? A. Ranitidine, B. Omeprazole, C. Pantoprazole D. Antacid, ANS. Ranitidine blocks histamine H2 receptors and decreases gastric acid secretion. Q872. Which drug is commonly used in migraine prophylaxis? A. Propanolol, B. Salbutamol, C. Adrenaline D. Dopamine, ANS. Propanolol reduces frequency of migraine attacks by beta blockade. Q873. Which drug is used for opioid dependence treatment? A. Methadone, B. Diazepam, C. Aspirin D. Digoxin, ANS. Methadone is a long-acting opioid used in opioid substitution therapy. Q874. Which drug is used in constipation as a bulk laxative? A. Psyllium, B. Lactulose, C. Senna D. Bisacodyl, ANS. Psyllium absorbs water and increases stool bulk. Q875. Which drug is a carbonic anhydrase inhibitor? A. Acetazolamide, B. Furosemide, C. Mannitol D. Spironolactone, ANS. Acetazolamide inhibits carbonic anhydrase and reduces bicarbonate reabsorption. Q876. Which drug is used in ventricular tachycardia? A. Lidocaine, B. Omeprazole, C. Aspirin D. Cetirizine, ANS. Lidocaine suppresses abnormal ventricular electrical activity. Q877. Which drug is commonly used in COPD management? A. Tiotropium, B. Atenolol, C. Digoxin D. Metformin, ANS. Tiotropium is a long-acting anticholinergic bronchodilator. Q878. Which drug is used in anaphylaxis to improve blood pressure? A. Adrenaline, B. Propanolol, C. Verapamil D. Aspirin, ANS. Adrenaline stimulates alpha receptors causing vasoconstriction and increased blood pressure. Q879. Which drug is a broad-spectrum penicillin? A. Amoxicillin, B. Ciprofloxacin, C. Doxycycline D. Azithromycin, ANS. Amoxicillin inhibits bacterial cell wall synthesis and acts against many bacteria. Q880. Which drug is used in tuberculosis causing orange discoloration of urine? A. Rifampicin, B. Isoniazid, C. Ethambutol D. Pyrazinamide, ANS. Rifampicin commonly causes orange-red discoloration of body fluids. Q881. Which drug is used as a sedative hypnotic? A. Phenobarbital, B. Aspirin, C. Metformin D. Omeprazole, ANS. Phenobarbital depresses CNS activity and induces sleep. Q882. Therapy. A. Ondansetron, B. Lactulose, C. Digoxin D. Aspirin. Ondansetron blocks serotonin receptors involved in vomiting reflex. Q883. Which drug is used in type 1 diabetes mellitus? A. Insulin, B. Metformin, C. Glibenclamide D. Pioglitazone, ANS. Insulin replaces deficient endogenous insulin in type 1 diabetes. Q884. Which drug is used as an antifungal in candidiasis? A. Nystatin, B. Acyclovir, C. Ciprofloxacin D. Doxycycline, ANS. Nystatin binds fungal cell membrane sterols causing leakage of cell contents. Q885. Which drug is used in severe pain management? A. Morphine. B. Paracetamol. C. Aspirin. D. Ibuprofen. Ans. Morphine. Morphine acts on opioid receptors producing strong analgesic effect. Q886. Which drug is commonly used in anxiety disorder? A. Alprazolam. B. Digoxin. C. Aspirin. D. Omeprazole. Ans. Alprazolam. Alprazolam enhances GABA in anxiety disorder. A. Alprazolam. B. Aspirin. D. Omeprazole. Ans. Alprazolam. Alprazolam enhances GABA-mediated CNS inhibition and reduces anxiety. Q887. Which drug is used in iron overdose poisoning? A. Deferoxamine. B. Naloxone. C. Atropine. D. Vitamin K. Ans. Deferoxamine. Deferoxamine chelates excess iron, promotes its excretion. Q888. Which drug is used as an antiprotozoal agent? A. Metronidazole. B. Penicillin. C. D. Azithromycin. Ans. Metronidazole. Metronidazole damages anaerobic organisms and protozoa. Q889. Which drug is used in hyperlipidemia? A. Rosuvastatin. B. Metformin. C. Omeprazole. D. Diazepam. Ans. Rosuvastatin. Rosuvastatin inhibits HMG coreductase and lowers cholesterol levels. Q890. Which drug is commonly used as an anthelminthic? A. Albendazole. B. Ciprofloxacin. C. Doxycycline. D. Fluconazole. Ans. Albendazole. Albendazole inhibits glucose uptake in parasitic worms leading to their death. Q891. In bronchial asthma is a leukotriene antagonist. A. Montelukast. B. Salbutamol. C. Theophylline. D. Adrenaline. Ans. Montelukast. Montelukast blocks leukotriene receptors and decreases airway inflammation. Q892. Which drug is used for emergency control of seizures? A. Lorazepam. B. Aspirin. C. Digoxin. D. Atenolol. Ans. Lorazepam. Lorazepam rapidly enhances GABA activity to stop seizures. Q893. Which drug is commonly used as an antacid? A. Magnesium hydroxide. B. Omeprazole. C. Pantoprazole. D. Ranitidine. Ans. Magnesium hydroxide. Magnesium hydroxide neutralizes excess gastric acid in the stomach. Q894. Which drug is used in bacterial meningitis as a third-generation cephalosporin? A. Sfotaximi, B. Penicillin, C. Doxycycline, D. Gentamicin. Ans. Sfotaximi. Sfotaximi penetrates CSF effectively and inhibits bacterial cell wall synthesis. Q895. Which drug is used for motion sickness and vertigo? A. Meclizine, C. Metformin, D. Omeprazole. Ans. Meclizine blocks H1 receptors and reduces vestibular stimulation. Q896. Used in hypertension as a beta blocker. A. Metoprolol, B. Salbutamol, C. Dopamine, D. Adrenaline. Ans. Metoprolol selectively blocks beta 1 reducing cardiac workload. Q897. Is a uricogenic agent in gout. A. Probenecid, B. Allopurinol, C. Ibuprofen, D. Aspirin. Ans. Probenecid increases uric acid excretion through the kidneys. Q898. Which drug is commonly used as a topical antiviral agent? A. Acyclovir, B. Fluconazole, C. Metronidazole, D. Amoxicillin. Ans. Acyclovir inhibits replication of herpes viruses. Q899. Which drug is used in emergency cardiac arrest? A. B. Atropine, C. Verapamil, D. Digoxin. Ans. Adrenaline stimulates cardiac activity and improves coronary perfusion during resuscitation. Q900. Which drug is used for osteoporosis to increase calcium absorption? A. Vitamin D, B. Aspirin, C. Metformin, D. Diazepam. Ans. Vitamin D enhances intestinal calcium absorption and supports bone mineralization. Q721. Which method is used for tablet preparation? A. Direct compression, B. Wet granulation, C. Dry granulation, D. All of these. Ans. All of these. Q722. Which agent? A. Lactose, B. Talc, C. Peg, D. Gelatin. Ans. Lactose. Q723. Which instrument is used to measure hardness of tablets? A. Monsanto tester, B. Fibrillator, C. Dissolution apparatus, D. Autoclave. Ans. Monsanto tester. Q724. Which dosage form is used for local skin action? A. Ointment, B. Injection, C. Tablet, D. Capsule. Ans. Ointment. Q725. Which is used as preservative in injections? A. Benzyl alcohol, B. Talc, C. Lactose, D. Peg. Ans. Benzyl alcohol. Q726. Which is used as isotonic agent? A. Sodium chloride, B. Talc, C. Peg, D. Lactose. Ans. Sodium chloride. Q727. Which is used as buffering agent? A. Phosphate buffer, B. Talc, D. Lactose. Ans. Phosphate buffer. Q728. Which is used as suspending agent? A. Acacia, B. Alcohol, C. Talc, D. Ans. Acacia. Q729. Which dosage form is used for nasal route? A. Nasal spray, B. Tablet, C. Capsule, D. Injection. Ans. Nasal spray. Q730. Which is used as propellant in aerosols? A. LPG, B. Water, C. Alcohol, D. Talc. Ans. LPG. Q731. Which is used for sterilization by filtration? A. Membrane filter, B. Autoclave, C. Dry heat, D. Radiation. Ans. Membrane filter. Q732. Which is used as emulsifying agent? A. Span 80, B. Talc, C. Lactose, D. Peg. Ans. Span 80. Q733. Which dosage form is used for rectal route? A. Suppository, B. Tablet, C. Capsule, D. Syrup. Ans. Suppository. Q734. Which base is used for suppository? A cocoa butter B talc C peg D lactose, uns, cocoa butter. Q735. Which is used as humectant? A glycerin B talc C lactose D peg uns, glycerin. Q736. Which is used as thickening agent? A carbopol B talc C lactose D peg uns, carbopol. Q737. Which is used as ointment base? A petrolatum B talc C lactose D peg uns, petrolatum. Q738. Which dosage form is used for inhalation? A aerosol B tablet C capsule D syrup uns, aerosol. Q739. Which is used as binder? A PVP B talc C peg D lactose uns, PVP. Q740. Which is used as lubricant? A magnesium stearate B lactose C peg D gelatin uns, magnesium stearate. Q741. Which is used as disintegrant? A sodium starch glycolate B talc C peg D lactose uns, sodium starch glycolate. Q742. Which dosage form is sterile? A injection B tablet C capsule D syrup uns, injection. Q743. Which is used as antioxidant? A BHT B talc C lactose D peg uns, BHT. Q744. Which is used for particle size reduction? A ball mill B autoclave C dryer D filter uns, ball mill. Q745. Which is used for mixing powders? A double cone blender B autoclave C dryer D filter uns, double cone blender. Q746. Which is used as coating agent? A HPMC B talc C lactose D peg uns, HPMC. Q747. Which dosage form provides immediate release? A IR tablet BSR tablet CCR tablet D capsule uns, IR tablet. Q748. Which is used as preservative? A parabens B talc C lactose D peg uns, parabens. Q749. Which is used as surfactant? A tween 80 B talc C lactose D peg uns, tween 80. Q750. Which is used as vehicle? A purified water B talc C lactose D peg uns, purified water. Q751. Which is used as plasticizer? A glycerin B talc C lactose D peg uns, glycerin. Q752. Which dosage form is monophasic? A solution B suspension C emulsion D ointment uns, solution. Q753. Which is used as antioxidant? A talc B lactose C peg D gelatin uns, talc. Q754. Which is used as sweetening agent? A saccharin B talc C lactose D peg uns, saccharin. Q755. Which is used as flavoring agent? A menthol B talc C lactose D peg uns, menthol. Q756. Which dosage form is biphasic? A emulsion B solution C tablet D capsule uns, emulsion. Q757. Which is used as buffering agent? A acetate buffer B talc C lactose D peg uns, acetate buffer. Q758. Which is used as stabilizer? A EDTA B talc C lactose D peg uns, EDTA. Q759. Which is used for drying? A fluidized bed dryer B mixer C ball mill D filter uns, fluidized bed dryer. Q760. Which is used for capsule shell? A gelatin B talc C lactose D peg uns, gelatin. Q761. Which is used as emulsifying agent? A lecithin B talc C lactose D peg uns, lecithin. Q762. Which dosage form is semi-solid? A cream B tablet C capsule D syrup uns, cream. Q763. Which is used as preservative in syrups? A sodium benzoate B talc C lactose D peg uns, sodium benzoate. Q764. Which is used for filtration? A membrane filter B autoclave C dryer D mixer uns, membrane filter. Q765. Which is used as thickening agent, a xanthan gum B talc C lactose D peg uns xanthan gum. Q766. Which dosage form is for buccal root, a buccal tablet B injection C syrup D capsule uns buccal tablet. Q767. Which is used as solvent, A alcohol B talc C lactose D peg uns alcohol. Q760.